Today, more than 8 million people in the United States are living with psoriasis. People living with psoriasis may understand the negative impact that the symptoms can have on their lives, and many people, including older adults, are struggling to find the right treatment for them. Hi, I'm Danielle Kunkel-Roberts, co-founder of Boomer Benefits and author of the best-selling book, 10 Costly Medicare Mistakes You Can't Afford to Make. This video is sponsored by Sun Pharmaceutical Industries, and in this video, I am going to give you an overview of how Medicare Part B covers injectable biologic treatment for moderate to severe plaque psoriasis. So, what is psoriasis? According to the National Psoriasis Foundation, psoriasis is a disease that causes inflammation in the body and can lead to plaques and scales on the skin because of overactive skin cell growth. These plaques can be itchy, red, and sometimes painful. With moderate to severe plaque psoriasis, patients experience at least 3% and sometimes more than 10% of their bodies covered in plaques, which can be painful and isolating. You might be wondering, how does psoriasis impact older adults? The second peak onset of psoriasis is in adults aged 50 to 60 years old. Treating moderate to severe plaque psoriasis in older adults can be difficult because of the increased prevalence of comorbidities, including psoriatic arthritis, cardiovascular disease, metabolic syndrome, and mental health concerns. Additionally, with so many treatments available, such as steroid creams, oral medications, light therapy, and biologics, it is common for older patients to have experienced decades of treatments and feel frustrated with finding an effective treatment for them. An additional consideration for older adults is finding affordable treatment options for patients with Medicare benefits. Medicare is broken up into 4 parts, parts A, B, C, and D. As it pertains to medications, these can be obtained under parts B and D. Part B is for any medication that must be administered by a healthcare provider. For this type of medication, patients will go to their provider's office or to an alternate site of care to receive the medication by either an injection or IV infusion. Under Part B, the patient has a 20% coinsurance after they pay the Part B deductible. For those patients with a Medicare supplement plan or secondary, it helps pick up some or all of this cost, making it an affordable option for Medicare patients. Prescription medications that are self-injected by the patient are covered through the pharmacy benefit under Medicare Part D. For specialty drugs, such as those self-injectables prescribed for psoriasis, the patient could have considerably more costs associated with their treatment. In 2022, the patient is responsible for the Part D deductible and then up to 25% of the cost of their prescriptions, up until you reach $7,050 in out-of-pocket costs for covered drugs. Unfortunately, there are no supplemental plans available to pick up your costs under Part D. Ilumya is a great example of a treatment for moderate to severe plaque psoriasis that is covered under Medicare. Because Ilumya is an injectable administered by a healthcare professional, it is labeled as a medical benefit and is covered under Medicare Part B. This means that if you have Medicare Part B with supplemental insurance, your treatment may cost you as low as $0. Ilumya is the only drug of its class covered under Medicare Part B, making it a great option for adults 65 and older. It is also administered with fewer doses than most other biologics used to treat moderate to severe plaque psoriasis. This dosing schedule may work well for older patients who want to travel often and are busy enjoying their retirement. Patients who are over 65 years old experience similar efficacy and safety results as other age groups. It is important to note that results may vary from patient to patient. Before starting any treatment, patients should talk to their doctor and review the important safety information to understand the potential risks. The most common adverse reactions for Ilumya compared to placebo are upper respiratory infections, injection site reactions, and diarrhea. These are not all of the possible side effects of Ilumya. Ilumya is not for everyone. Only your doctor can help you determine if it's right for you. Do not take Ilumya if you are allergic to Ilumya or to any of its ingredients. Ilumya may lower your ability to fight infections and may increase your risk for infections. Before starting treatment, your doctor should check you for tuberculosis and infections. To learn more about the efficacy, safety, and dosing for Ilumya, go to illumya.com. If you have questions about getting Ilumya covered under Medicare Part B, consult your physician. Sun Pharma also offers financial assistance through their Ilumya support program. Please pause this video to read some important safety information. Thanks for watching. We will see you in the next video.